You know, the opioid crisis obviously is you can't go a day without seeing multiple news stories, it seems, on this issue, and it is a major issue, really a tragedy, I think, for the health of the U.S. population. You know, of course, the obvious is premature death, you know, mortality, the impact on families, and so forth and so on. But when you extend beyond that, I think you can look at the cost of the opioid crisis in a variety of different dimensions. You can look at, first of all, who bears those costs. And there you can look at the individuals who are affected themselves, the family members of those individuals. You can look at state governments, local governments, as well as the federal government. And so we tend to look at sort of cost in a variety of different buckets. So for example, if you're a Medicaid recipient and you know a Medicaid recipient has an overdose or needs treatment or therapy, oftentimes Medicaid is incurring costs that it would not have had to occur had that overdose not happened if we were able to prevent the epidemic. Oftentimes individuals with addictions and with overdose, you know, get into the criminal justice system, and that involves not only sort of policing, but oftentimes incarceration, and then judicial service cost as well. And so if you look at cost of states of having to deal with just the corrections or the judicial services associated with these cases, whether it's from an overdose or addiction, or whether it's somebody supplying the drugs, there are significant expenditures there as well. You can look at foster care costs, children who find themselves without a parent removed from the home, a parent who suffered from a premature death, and states or counties are overloaded in their foster care load as a result of this epidemic. So it really is pervasive, but I would say criminal justice, education, special education in particular, children, youth, and services costs like foster care. There's certainly the medical care expenditure costs, Medicaid, commercial insurers, Medicare. So it really is a pervasive epidemic, and really, again, individuals, families, and then local, state, and federal governments all have incurred costs as a result of this epidemic.